The very latest with regards to the situation in that country. Bruce Harrison is our correspondent there. Bruce, a very good morning to you. So we know that we have over 6,000 cases in South Korea with over 40 deaths. What are you learning this morning?
Well, most of those cases are still located in the country's southeast. I'm here in the capital, Seoul, and I'm actually in a district called Yongsan, and there's one case in this particular district, and there's more than 200,000 people that live here. So I think Seoulites, while cautious, do feel a bit of relief knowing that despite the fact that in the southeast, the epicenter of the outbreak here, the city of Daegu, is just 3 hours away by car, there hasn't been a widespread outbreak here. But the situation still in that city, Daegu, as well as neighboring North Gyeongsang province, is still quite dire. The government is doing its best to bolster medical support down there, get more hospital beds, build new medical facilities for what is still a surging number of patients. You said it, more than 6,000 at this point. 2 weeks ago, no one could have believed this was possible. It was just a trickle of cases back then.
Something very interesting as well, Bruce. There seems to be this app that South Korea is using. So South Korea using technology in order to combat COVID-19. And this app basically, correct me if I'm wrong, tells you where there might be a case of coronavirus, correct?
Correct. Well, there's a lot of technology in play right now. I have an app that I'm using, for example, because I had been in Hong Kong. So anyone traveling from China or Hong Kong is required for 2 weeks to check in on an app and give their symptoms. Now, my app doesn't keep track of where I'm located. There's no GPS feature built into that. For people that have contracted the coronavirus and tested positive, this app is mandated by the government, and it has a GPS feature. And that's basically to make sure the government knows that you're staying within your quarantine zone, which is typically someone's home. Now, while obviously the goal is to make sure the virus doesn't spread and these contaminated people don't come in contact with others, there is some criticism of this app. It's got a bit of a big brother aspect about it. But from what we know, the government's only making sure people are staying at home.
Well, talk to us about travel restrictions. I understand there's some tension with regards to South Korea and Japan.
Indeed, yes. Japan had put travel bans on South Koreans and travelers who had come through the regions I mentioned earlier, the city of Daegu as well as North Gyeongsang province in the southeast. That was the first step, and now things have escalated to a point where Korea has eliminated visa-free entry for Japanese or travelers coming from that country under the need to prevent more viral spread in this country. But what this really looks like is another political bout between Japan and South Korea. It's not limited to the coronavirus when it comes to the way they attack one another. It could be economic. In this case, it happens to be because of the virus outbreak.
Yeah. And it seems that South Korea has this aggressive drive to test people. Over 100,000 people, I understand, reportedly have been tested so far. And you even have a drive-through testing facility.
Yes, I haven't been through myself yet. I'm trying to avoid places where people could be contaminated if I don't need to be there. But the creators behind this, the government employees that decided to come up with this idea, said they were inspired by McDonald's and Starbucks. A quick drive-through procedure. You get in, you get out. It takes about 10 minutes. You don't have to leave your car, just like if you're getting a Big Mac from McDonald's. And it's supposed to reduce the risk to the medical workers as well, because they're in full gear and you're not in a room where you can cough or potentially spread the virus. You're in your car. They reach through the window. They swab the inside of your nose. They take your temperature. And there's one other diagnostic test. And then you find out within 2 or 3 days if you have the coronavirus. And this is a good thing because it's not just people who are symptomatic. If you're asymptomatic and you feel like you should be tested because you're in a neighborhood where there was a confirmed case or even a district in Seoul, you can go and get this done. And this is helping in the long run, I think, going to prevent more spread in this country.
Yeah, it's amazing how countries, need to adapt on the fly, so to speak, and adjust to this, in order to prevent more cases of COVID-19. Talk to us about what has become a new lifestyle, I guess, for people living in South Korea. How have they adjusted?
Well, it's difficult for some, especially people that have tested positive, and even those who aren't deathly ill, experiencing mild symptoms with the virus, have been put on lockdown now, and that's the most difficult for people in the city of Daegu, which really is been hit hard. People aren't going out. The local economy is suffering. Small businesses, restaurants, retailers, because people are afraid of catching it. Where I am in Seoul right now, there's caution, but people are still going out. People are still shopping, going to restaurants, just at a much slower rate. Public transportation's a bit ghostly at times, but this is not a ghost town at this point. I've seen some reports indicating it appears this is the end of times. That's the furthest from the truth here in Seoul. People are being smart. They're avoiding gatherings, large crowds. Family events have been canceled. 12 to 24 people, they've decided to put that off. And then to much larger events like concerts and sports events.
Yeah.
But daily life is going on. A lot of people are working from home. But everyone here in the capital is just hoping we don't have that wider outbreak like Daegu, because then things really could change, and this could become that ghost town that some reports have indicated.
So, I guess daily life needs to go on. And that's the message here as well, Bruce, in South Africa, is that don't panic, but obviously be vigilant. Bruce Harrison, appreciate your reporting.
No.
Bruce Harrison,
Yes.
live from Seoul in South Korea. You heard what the president said a couple of days ago, as well as what the health minister keeps on repeating in terms of be vigilant. Obviously, take this seriously, but there's no need to panic at this stage. What we know from the WHO is that about 80% of people who contract this virus recover well. Those people that are at risk are the elderly and those that have underlying conditions such as heart disease, such as chronic lung disease, as well as diabetes. So those people need to be very, very careful with regards to this. But obviously precautions need to be taken. Washing your hands, it can't be, underlined enough. Washing your hands is very important in order to curb the spread of this virus. I want to take you now to